Thanks for joining us this Monday as we begin a new week, focusing on some key goals the mayor has set for us to keep us on course as we navigate these challenging times here in Orange County. The mayor will speak on multiple topics, which include a curfew announcement, the distribution of CARES funding, and much more. Dr. Raul Pino was here from the Florida Department of Health in Orange County. He has his important information on COVID-19 and its effect here locally. And Mayor Buddy Dyer from the city of Orlando is here with important details regarding the tornadoes over the weekend and testing information in the city of Orlando. We start with Orange County Mayor Jerry Demings. Mayor.
Okay, thank you, Dr. Williamson. Thank you all for being here. Let me just start by talking a little bit first about the weather phenomena that we had over the weekend. Those of you in the media, I know you've been following it. Earlier today on our executive policy group call, the Orange County Property Appraiser's Office informed me about the extent of the damage that occurred. What I was told was that we had 42 different sites that had direct damage, and the approximate destruction is about $1 million. In fact, what they said, it was $955,700 in destruction that occurred within that 42 sites, both commercial and residential locations. We're fortunate, to our knowledge, there were no injuries that occurred. So as we move forward in this era of a pandemic, we have said that as we approach June 1st, the beginning of hurricane season, it was very important for us to make certain that we reviewed our plans to deal with weather phenomena, and we've done that. So our Emergency Operations Center had to activate specifically to assist in the response efforts. The Orange County Fire Rescue Department worked with other agencies here, including the City of Orlando Fire Department, in terms of the joint response, and overall, I believe that they were successful in assisting with tree removal and other things that had to be done out in that area. We worked with the American Red Cross as well, and so I had a conference call earlier today with the executive director of our local Red Cross to make certain that we're prepared moving forward as we deal with the weather phenomena. So also this weekend we continue, as you know, to have additional demonstrations here within our community, and I am going to terminate for the unincorporated area, inclusive of all of those cities with the exception of Orlando. We're terminating the curfew order that was put in place, and so there will not be a nightly curfew going forward beginning tonight. I also want to talk about the goals that we have for the week. Each week as we begin, we set some goals, some stretch goals for ourselves to accomplish during that week. And we've done that this week. This week, of course, our primary goal remains stopping the spread of the virus. So you'll hear me say that. That's still part of the focus that we have. We also want to begin the process of serving those families and individuals through our CARES Act application process. We started that today. I'll talk about that in just a few moments. In addition, we started a process of serving as many businesses as we possibly could through our CARES Act funding. Now let me talk about the number of cases that we have in Orange County. We continue to see new cases here within our county. We have 2,378 cases of individuals who have tested positive for the virus. We have 45 deaths to date. Dr. Pino will talk to you in just a few moments about the numbers and what he's seeing there. We have tested over 83,000 individuals in Orange County with our positivity rate at 2.9%. Of course, it's still relatively low, but you all know that for several days it was 2.8%. Statewide, the positivity rate is 5.3%. Let me talk now about our jail. I wanted to brief you on something. Just a few minutes ago, I was briefed by our corrections chief. We had our very first case where an inmate tested positive in our jail. Now, that inmate was transferred to our jail from the Florida Department of Corrections. and that inmate, when he was transferred, was known to be positive already for the virus itself. And so we have taken appropriate precautions as that individual was screened through our jail. He entered the jail on June the 4th. And so we are working through all of the HIPAA-related laws in terms of confidentiality and how we deal with that individual. He happens to be asymptomatic, so he does not have symptoms, but he is now in a negative airflow cell at corrections, and again, because of HIPAA laws, we have some concern for not only the other inmates, but our employees that work at the jail itself. And so I wanted to share that with you. As you know, there's been much conversation here within Florida about the State Department of Corrections and individuals within the State Department of Corrections who had tested positive. But we have been fortunate that we didn't have anyone. Now, that's pretty unique because the Orange County Jail is really a microcosm of Orange County. So if we have the virus in Orange County, the fact that here we are months into this and we had not had any inmates, and by the way, we continued to have law enforcement bring in arrestees or defendants into our jail, and the fact that we just got the first one is pretty extraordinary. Now, when anyone is booked through the jail, they go through a screening process. They have to go through a medical screening where a nurse evaluates that individual, and if they show any signs of or symptoms of any of the indicators of the virus, those individuals are tested, and we put them, all new entrants into the jail are segregated into a particular area for a minimum of 14 days before they are allowed to move into general population within the jail. So we've had that protocol in place for some time now, and it had been successful, I believe, in preventing someone entering the jail with the virus. So we don't have currently, we do not have any correctional officers who are positive for the virus. Over time, we've had a few, very few correctional officers who tested positive, who have fully recovered. We've had some civilian staff at our jail who have tested positive as well, but to date, I think from what the chief tells me, we have 5 non-certified individuals, I mean non-correctional officers who had tested positive, and they in various phases of recovery at this point. So it is concerning to us that we really want to do the best that we can to make certain that that jail remains COVID-19 free. And so we're working on that. But again, it's a good indicator that the virus is still alive and well in our community itself. We're going to be doing testing this week, today through Thursday at Ventura Elementary School. So it's by appointment. So if you're interested, you can go to our website and sign up for the testing there. We also are going to be doing testing this week in partnership with the Orlando Housing Authority. On Tuesday and Thursday, we are focusing on vulnerable community, those seniors and others who live within public housing. That will be done at the Omega Apartments and the Meadow Lakes Apartments. And again, a testing appointment is required. We're asking individuals who live within those 2 complexes to notify us through ocfl.net/coronavirus to sign up, or they can simply call. In terms of the CARES Act funding, rollout occurred this morning. From my perspective, the business rollout assistance went very well. This is where we were offering $10,000 grants to qualified businesses, small businesses of 25 or fewer. And at this point, some 1,575 businesses have successfully submitted all of their documents to qualify. That website is still open and taking applications online for the business assistance. We had less success, if you will, with our individual and family assistance rollout. So our staff had a desire to try to manage the applications that we would receive at any one time, get them processed, get them moving along. And quite frankly, I wasn't so pleased with how that rollout occurred today. So as a result, we're going to reopen it tomorrow, and we will reopen it and look to take applications from as many as 20,000 different individuals, and we'll just get them into the system, and then we'll process them as we move forward. And then at some point, once we get those processed, we'll open it up for remaining 20,000. So I think it's a better way for us to manage the demand within our community for the crisis assistance, that is for rental assistance, mortgage payment assistance, medical assistance, utility bill assistance. I think, and it's the desire of the Board of County Commission to get funds in the hands of our residents as quickly as possible, deal with the anxiety of people. So we're going to make some adjustments there. So I'm telling you that up front. If you have any questions later, I brought the staff in that's been dealing with that today. And overall, they've done a good job of dealing with it. But, I had to make some decisions about how we deal with this going forward. So that is the update I'm going to provide at this point. Mayor Dyer, I know that Dr. Pino has a virtual town hall that he's trying to get to. So if it's okay with you, Mayor, will we let Dr. Pino go and give his update? Thank you.
I didn't know you knew about the virtual town hall. So the numbers are what the mayor has reflected in his presentation, and we have seen an increase in the number of cases. It continues to go up, and I'm going to explain a little bit more about that. Our positivity rate is at 2.9%. That was where we were on May 22nd. And we also, the recovery rate has decreased to 82 from 87. That means, of course, we have more individuals, so the data will reflect that. The number of cases, is important to notice that half of all cases in the last 14 days has been on people between 20 and 40 years old. So the pandemic is going a lot younger for us, which to a degree is better than in the other direction. And we also have seen the number of cases from week 22 to week 23, which was last week, increased by 44%. So we're clearly having a little bit of an uptake. Now, interesting, our median age, which is a reflection of the age, has decreased from 37 that we had it before to 35. So we are getting younger. And we didn't have any hospitalizations in June 1st or the 2nd, and the first one this month was in June 3rd. We have additional fatalities. Number 43, 55-year-old female, Black, non-Hispanic, was in the hospital for 10 days, pre-existing conditions. The person died on June 3rd. Fatality number 44, 44-year-old male, Hispanic. The exposure is unknown. We know a little bit more about this case that we cannot disclose, but the age should not be much of a concern, although it's a younger person. There were other conditions, healthy conditions there that precipitated the outcome. Part of that was also that the person refused medical care, and the person died on May 31st outside the state, but it will count as a fatality for us. And fatality number 45 It's a 60-year-old male, white, non-Hispanic, travel was exposure, pre-existing condition, and died on June 5th. With the data, I would like to explain that when we were at our highest, our incident rate per 100,000 was 21.4. Our incidence rate last week was per 100,000, 16.8. So we are still below what we were at the highest point. And also, we continue to monitor the data with regard to hospitalizations, ER, and ICU beds, as well as ventilators. And in those areas, everything is performing well. Although we have learned from the past that runs 2 weeks behind. So it will be interesting to see if the cases continue to increase, how that data perform. But the fact that we are seeing a younger population may also be part of the reason why our hospitalization rates continue to be low, our ICU use continue to be low. We also have monitored other trends in the data, and the county at large, when you compare it to other areas of Florida, continues to perform well. The number of cases is not the only number, although it's an important number, but we also have increased the number of tests. If you look at our testing capacity, has basically almost doubled when you compare to 5 weeks ago, 6 weeks ago. So it's also expected that you will find more cases. And I think another contributing factor to the number of cases is the way that we are going after cases. So different than other sites around the state, we have decided to test at outbreaks, meaning we are moving our tactical units into outbreak situations and test everyone in the outbreak. The idea is to find as many asymptomatic people as possible before they really transmit. And just to give you an example, without naming the place, we recently had an outbreak that we tested last week, and out of 300 people, we got 77 positive asymptomatic people in general, in total, in that outbreak. So those are important numbers that we also are controlling for, and is part of all the information that we use to process. So with that, I pass it to Mayor Dyer.
Thank you, Dr. Pino. I know we're here this is a COVID press conference, but I also, as Mayor Demings did, want to remind everybody that we are a week into the hurricane season, and we've already seen 3 named storms, and we know that we can have severe weather. I don't think we've had a tornado in the city limits of Orlando in my lifetime. I know we haven't had a pandemic, and we haven't had 10,000 people demonstrating in our streets. So on Saturday, we had 3 things that had never happened in my lifetime, all happened on the same day in Orlando. So we had a tornado that touched down, and it moved on pretty much a 5-mile path from Lake Conway to Thornton Park. It originated as a waterspout in Lake Conway and then dispersed once it jumped over the 408. It was estimated to have a peak intensity of 100 to 105 miles an hour. Mayor Demings has described some of the property damage that occurred. OFD and Orange County Fire both responded. When it first came through, there were about 3,800 residents that lost power. OUC had the first 3,000 restored in about 30 minutes. There were a couple transformers that their breakers flipped down on Michigan. They were able to restore them very quickly, and within a few hours had everybody else back up with power. And thankfully, there were no reported injuries at all that I'm aware of. It's a good reminder, though, that we can't be complacent about the weather during the summertime. You want to have your family emergency plans, your hurricane kits, and most importantly, you want to stay informed about weather events. And I'll give you a really good example. You've all seen the pictures of the lady whose house had the tree fall on it down on Harding. And I was talking to her the next morning, and she said, I was out on the porch with my granddaughter, corner of the house, and I was watching the streamers across the bottom of the TV and saw the warning about tornado activity. And I thought better of staying where we were, so we moved to the back of the house, into one of the very back bedrooms. And within 5 minutes of us moving from that location, the tree fell right where we had been sitting. So thank you, whatever news service was tickering that across the bottom that had them get out of harm's way. We also can't be complacent about COVID-19. We want to continue to remind everybody, if we aren't going to experience another spread or outbreak, we need to wear a mask, we need to get tested, we need to practice good hygiene, we need to continue to physically distance. We have it under control now, but it doesn't mean that we can keep it under control. Testing remains critically important. We're going to rotate now to Wednesdays with our city residential testing. So Wednesday, June the 10th, we'll be at Lake Nona Middle School from 9 a.m. to 1 p.m. If you want to sign up for an appointment, it's orlando.gov. Also, we continue to have demonstrations. There were 75 people outside City Hall when I left this morning. I want to thank our residents who are showing this country what unity and strength looks like. We had very peaceful protests over the weekend. In fact, we had no arrest. We lifted the 8 o'clock curfew for downtown yesterday, and I'm going to join with Mayor Demings and lift the 10 o'clock curfew that is for citywide. I signed an order just before I came over here, so both the 8 o'clock for downtown is lifted and the 10 o'clock for citywide is lifted. Thank you, Dr. Pino. Thank you, Mayor Demings. I'll turn it back over to you, Mayor Demings.
Okay, thank you, Mayor Dyer. And at this time, we'll open it up for any questions that you may have.
Hello, Lauren Seabrook. My question's for Dr. Pino.
Dr. Pino?
Just a couple of questions about the age groups. Do you have any indication that some of these could be from either protesting or maybe the Memorial Day weekend? And just my usual question with this uptick, are you getting concerned at all with more and more things reopening?
So it may be more related to Memorial Day weekend than it is to recent activities, social activities. We normally see these, for what we have observed, 2.5 weeks, 3 weeks out of any of these things, then we see an increase in the number of cases. Concerned? No, not concerned in that sense. So we have always said that this would happen. We have always said the number of cases will increase as we increase our social activity. Short of a vaccine and a cure, which we don't have either, we are going to learn, we have to learn how to live with the virus. And I think my major concern or things that I'm watching for is how the healthcare system responds to it. Because as long as we have an ability to respond to it from public health and the healthcare system, we should be fine. I think we should also concentrate in protecting those who are most vulnerable, and especially assisted living facilities, home visitations, home services, first responders and healthcare workers and people experiencing homelessness. Those are areas that we want to, because those are areas where if we have an outbreak, it could go explosive and have poor health outcomes. So those are the things that we are watching. Now, the fact that it's getting younger, although we don't want anyone to be infected, it means that a population that is able to handle the infection better is the one acquiring the infection at this point. And with that, we are watching, and that may be an explanation why our hospital utilizations continue to be so low.
Okay, let's do something also in that Dr. Pino is going to leave. If any of our Spanish-speaking media have questions for Dr. Pino, I want to make sure you get to ask them before he leaves here momentarily. So do we have any questions from our Spanish-speaking media at this time? Okay, I'm not seeing any, so we'll proceed with the next question.
Hi, this is also for Dr. Pino. Is the uptick in cases, does that have to do with the protests, or is that because we're seeing more testing? And then the second question is, do you think that Florida needs a specialized task force to deal with the coronavirus at this point?
So on the last one first, I only work for Orange County. So the question for Florida has to be for the state surgeon general. And with regard to the protesters. It's too early in that to have an idea, and I think it has to do more with an increased social activity. And it's perceivable. You can see that our social activity has increased. Again, what we are watching is to what speed are we increasing and how is that happening. Now, we have high increases before 1 week. We had an uptake of 51% with regard to the week before, and it didn't continue. It was not a pattern. So we have to observe if this is a pattern or not, but we are clearly climbing the numbers.
Hi, Eric Sandoval with News 6. A question for Mayor Demings. Can we talk about the CARES Act funding application process this morning? What happened? Why weren't you happy? What specifically made you not happy and demand change?
Well, I didn't like the fact that we were starting and stopping. Essentially, our staff looked at trying to manage the potential volume of people who were accessing the system, and they thought that it would be better to take a few thousand today, get them processed very quickly, open it back up, take another 2,000. So our system had the capacity to be able to handle much more than that. But so what I wanted us to do was not to look at it from what makes it easy for us, but what makes it easier for the citizens to deal with the anxiety, the anxiousness associated with knowing that I've applied, I've submitted my paperwork, I'm being considered. So I think that if we change that to put more of a focus on the citizens, let's just open it up for thousands. And if we find where somehow the processing of that may take some period of time, we just have to communicate with the citizens during that period of time. So that's what I've asked them to do, is that if I know that I've submitted my paperwork, there's hope for me, because we have told them in advance what the guidelines are to qualify. So intuitively, an individual may very well know if they're within a household whether they qualify or not. So if I've applied for the money, I may have some solace in knowing that the money is coming. If I'm trying to figure out in 2 weeks or 3 weeks that I got to pay rent, and if I know it's coming, then I can be more definitive in communicating that to my landlord or whoever I may owe. Whereas our staff didn't want to really put people on hold for weeks and not have the final approval, I'd rather know in advance that I'm in the hopper. So that's kind of why I'm, in terms of changing the philosophy about what we're doing here, being as transparent as we can. Our goal is to help as many of those families that we can with the dollars that we have. So I believe that with this modification, we're able to deliver, I think, more about what the citizens want. Now, I have some staff who are here who can get into some of the technical stuff because they're the ones dealing with it. But at this point, in terms of the public policy, I wanted to address kind of the philosophy behind why it happened, what we're doing to work through that. Okay, so does that make sense what I just said to you?
Could it slow down payments getting to these people, though?
No, I don't believe so, because the same number of people that they would have been able to process, they are processing. I don't know who the best person is. Diane Arnold is one of our managers in family services. What number of applications have we processed? Yes, where at this point today, where the people have submitted all of the paperwork that is needed.
So as of 2 o'clock this afternoon, we had only received 500 where everybody who had done it had submitted all the paperwork and checked off the last on the box. Now, there are people still in the system, because once they got in the system, they were able to continue submitting their paperwork for as long as needed. So there are people still in the system right now.
Okay, so if you understand what she's saying, even though they put an artificial stop, it had nothing to do with whether the system, the technology exceeded the capacity. No, this was an internal decision that was made. So what she's saying here is that 500 people, as of 2:30, had submitted all of their paperwork, okay, within just a few hours of us opening. But the remaining number, 1,500 plus, had submitted some portion of what was needed, okay? And that's again, within the first 5 hours or whatever it is of the system being open. So we can probably anticipate that. So we're processing them. That group that's in, things are still happening. We're going to process them. When we open it back up tomorrow, what's going to happen is it'll be another group of people that apply, and it'll have somewhat of a compounding effect. But I believe that over the succeeding weeks, we'll get through all of them, hopefully in a timely manner. Now that they had the dress rehearsal, I'll call it that, this morning, they learned some things from that. I believe the staff that's working on it about their capacity, their ability to understand what happens. And so we have some of the most talented staff here. So I'm confident that given the direction that we made, that they'll be able to make that adjustment and be successful in serving the people.
Hey, Eric Mock, Spectrum News 13 here. I have a question for each mayor. So first about the curfew for Buddy Dyer. You know, a lot of the protesters said it was, you know, they saw the curfew as a limit to their free speech. So why did you decide to go ahead and abolish it now? Was it because of pressure from protesters, or was it because of, or if not, then what was the reason?
No, it was good behavior by protesters. We got to a point where the protesters trusted the police officers and vice versa. We haven't had any arrests in, I think, the last 3 nights. Everybody knows how to protest at this point. In fact, I was asked at some other press conference why we thought ours had grown so big, and I think there's a lot of people that have come out and protest for the very first time in their life because they feel safe in the environment that's been created in downtown, both between the protesters and the police officers. So we lifted the 8 o'clock curfew yesterday and continued to have peaceful protesting in that regard. And the only time it wasn't peaceful, quite honestly, was the first couple of nights. At the end of the night, some handful of people, not that many, but I'd say 50 to 100, decided it was a good idea to throw rocks and bottles at police officers. And a number of them were struck, and they responded first by using smoke. And when they continued, that's the only time that OPD or any other agency for that matter has deployed any gas. As to the 10 o'clock curfew, both citywide and countywide, that was important not necessarily for the protesters, but to make sure that we didn't have looting and break-ins in other parts of the city and other parts of the county. There had been a lot of social media about a group taking over the Mall of Millennia. And in fact, that very first night, about 30 car loads of people showed up intent on taking over the mall. But we had personnel stationed there, and you'll recall that they ended up going across the street to a Dunkin' Donut, I think, and some other establishments. But since I'm losing track of the days and evenings now, but after the first 2 nights, I don't think we've had hardly any incidents of break-ins or vandalism outside of the downtown area, and that's why I believe the 10 o'clock curfew was important up to this point.
I agree with Mayor Dyer on this, but I do want to underscore something else. For me, part of the guiding principle here was it was all about seeing these thousands of people together and whether they would voluntarily wear a mask or not. Over time, what we saw was a significant number of people, the overwhelming majority, wore masks up. To Dr. Pino's point here, that in a couple of weeks, the data will tell us whether or not we hurt ourselves in this process or not. As we reopen and then we have these large demonstrations happening simultaneous at a time when we're living within a pandemic era. So I think it's twofold. I want you to understand kind of the multitude of things that went into the decision about the curfew and giving some guidance to people. We wanted to be able to manage both issues here within our community. Okay.
I read an article the other day that said, and Dr. Pino can correct me one way or the other on this, that people that speak loudly have more of a propensity to put out the particles. So if you're in a crowd with people that are chanting and yelling, it is especially important that people have masks on, or they're going to distribute the virus to people widespread around them.
Hi, this is for Dr. Pino, and then hopefully you can get out of here. So can you tell us a little more about the 77 positives out of 300 tests? That's an enormous positivity rate.
So as I mentioned before, we check our testing strategy from community-wide events because there are many other testing facilities, although we are planning to increase the number of places to a more outbreak-focused testing. Why are we doing that? Because we want to interrupt transmission. So the quickest we get to an outbreak is the easiest and fastest way to find the largest number of possibly asymptomatic people that we can have an impact on it. We believe that asymptomatic people are having a bigger role than initially thought. And the data is proving that approach right now. So part of what we are doing is, if we learn we have an outbreak, we do have a tactical team, we call it a strike team, and we send it in a mobile clinic to places to do testing. This place is in Orange County. It's a mattress factory. They had an outbreak, and they decided voluntarily to close the factory. So right now, that outbreak is about to be, we will test in 2 weeks in the outbreak to take any secondary transmission if that happened. We also have an outbreak in Apaka, in a Marshmoon farm, and we also did the same over there, found less cases. But again, we are doing this approach. And also, remember that the state has strike teams that are going across all assisted living facilities, doing testing for assisted living facility employees and residents. And although we haven't found outbreaks, there have been a few cases of asymptomatic people in those facilities. All that is to say that probably part of the increase in the number is also our active approach, our approach to actively look for positive cases. We are not sitting in our hands, and we are going after the places that we think we can find the most cases, because the more we find, the more are we likely to prevent transmission in the future.
Let me follow up that real quickly. We've had 4 or 5 days where clearly we have a trend that's going upwards. What do you see in the data, and if you're not concerned now, when would you be concerned?
So those are absolute cases number. So it doesn't take in consideration population rates, and it doesn't take into consideration the number of negative tests. So this is just positive test. Now, the curve that my team does for me takes into consideration the day that the symptoms were onset. The epi curve that I have. The state epi curve goes on testing day results. We go on symptoms day. I like that approach, although we look at both, because I think it gives you a better picture. With the labs, what could happen is sometimes we receive delayed lab results. There are a multiplicity of labs that may not be reporting electronically on the onset, and at some point they call what we call a data dump. And so it could be that we are receiving a number of cases that are older, maybe 5, 6 years, 6 days into the testing. I'm sorry about the years. So that's part of the dynamics. Concern, and not concerned. I'm actually surprised that he hasn't gone faster than it is. That our data is performing the way that it is. And I think in part it's also because the community, as the mayors have said, both of them, are taking a hard using masks. And you see a large number of people who are masked. And that's an important step to curtail the transmission of the virus.
Hi, Alibet Suárez with Más 100.7 FM. Mi pregunta para Dr. Pino. Quisiera saber cuál es el estatus de las pruebas públicas de anticuerpos. Si saben alguna información nueva, hace alrededor de un mes hice esta pregunta para saber si las personas pueden enterarse si se han recuperado del virus.
En español, ¿verdad? El estado, déjame ver cómo explico esto. Cuando tú tienes un problema epidemiológico, hay una cosa que se llama case definition, la definición del caso. ¿Quién es un caso? Y ahora incluye también tener una prueba positiva de anticuerpos. Antes esos números no estaban considerados como un caso. Y eso puede explicar también en parte un poquito de la elevación de los números. Y gracias por esa pregunta porque se me había olvidado tocar eso y lo voy a hacer también en inglés. Entonces, otra parte también es que el Estado inicialmente las pruebas de antibody eran solamente para los casos de trabajadores de la salud y first responders. Ahora la abrieron para todo el mundo. Entonces, esa es parte de la situación. En el Convention Center es el único lugar público donde se están haciendo los antibody tests. The question in Spanish was, what is the importance of antibody test and how is the process going? And I also remembered that I didn't mention in English that now antibody test is part of the case definition, meaning anyone who is positive for antibody test counts. So that's a recent development. So that could be also not a very significant number, but could contribute to the number of positive cases that we have. So meaning, in any epidemiological study, you have what is called case definition. So what is a case? And this is, it has to have this, it has to have this, it has to have this. Now, a person having a positive body test counts as a case.
Buenas tardes, Félix Pirela de Telemundo. Doctor Pino, quisiéramos saber para cuándo estima que se sepan las cifras en cuanto a si va a haber un nuevo repunte de casos de coronavirus considerando tanta gente junta de cientos y miles de personas en la calle acá en el condado Orange.
That's difícil. Es muy difícil predecir cuándo va a pasar. Lo que sí es claro es que estamos en camino hacia arriba. La base de datos muestra, aunque estos son casos, números absolutos, demuestra que ha habido un incremento en el número de casos. So the question in English, in Spanish was, when do we know that we are going up? When do we know we have a second wave? And it's difficult to know, although we are climbing in the number of cases. It's difficult to know. As I said on the first time, you will know when you hit the wave, the peak, when you are coming down. And that will be the only time that you will know, okay, we have a peak.
Dr. Pino, if you can, in Espanol, recap the numbers of the day in Spanish briefly. This is for Jennifer Marcial with El Sentinel, and also just speak about the protesters in Spanish and whether people that have participated have gotten tested to your knowledge.
What was the second part?
Can you talk about the protesters, and she would like this in Spanish, and whether people that have been participating in these protests, if you know, have been getting tested?
Is that in Spanish too?
Yeah.
So let me answer in English first. No, we don't know if any of the protesters have tested positive. We don't ask that type of question. The second part was the numbers in Spanish.
Yes, please.
Entonces, la respuesta en español a la pregunta siguiente fue si sabemos si alguno de las personas que están protestando ha resultado positivo. Nosotros no tenemos esa información, no preguntamos. El número de casos en español, tenemos 2.378 casos positivos, eso es acumulativo. Tenemos un 2.9% de casos positivos. Se ha recuperado el 82% de las personas y hemos visto un incremento del número de casos y la mitad de todos los casos en los últimos 14 días ha estado en personas entre 20 y 40 años de edad. lo que es significativo y tal vez tenga alguna correlación con las protestas, pero no sabemos.
Thank you. These next, last ones are for Mayor Demings, so.
Okay.
Yes. This one's from Melissa Thomas with Florida National News. Mayor Demings, Congresswoman
Hasta
Demings.
mañana, Dr. Pino. Okay.
Congresswoman Demings announced today that she co-sponsored a police reform bill, the Justice in Policing Act. What are your thoughts on her bill proposal for police reform, especially federal reporting of police misconduct?
I haven't read the bill. I've been busy doing other things today, so I can't really comment other than I know she knows what she's doing. So if she is proposing a bill, I think it will ultimately be a good thing.
This one comes from Megan Cruz from WFTV. Obviously, for you, Mayor Demings, and she's including Mayor Dyer in this. Are either of you considering defunding your law enforcement agencies? Leaders in other cities are proposing cutting their police budgets or getting rid of departments altogether as protesters rally to defund the police.
I'll take it first if you want. We're not looking at defunding our police agency. Police presence is important. I couldn't think of going a day without having our police officers in our neighborhoods. Will we look at our policies and our practices? Will we review our policies related to use of force and discipline? Absolutely.
And I'm not looking at defunding the Orange County Sheriff's Office either at this point, but I will say that law enforcement has been on the reform for the 4 decades I've been around it. And beginning January of 2021, the FBI National Incident-Based Reporting System goes into effect. So this was planned prior to the current situations that we see. That new system is designed to capture law enforcement interactions with the public where force is used, where a detention is made. That could be anything from a temporary detention related to a traffic stop to an arrest. And that system will require the collection of data, including the perceived race, gender, et cetera, of the individuals that law enforcement comes in contact with, to the crime-related data and related demographics associated with that. And so that is a requirement for every law enforcement agency within the nation to comply with those reporting standards that have been laid out. So I believe that most of the law enforcement agencies here within our local community have already transitioned to keeping data that would be consistent. It includes things such as if I'm a law enforcement officer and I draw my weapon, I don't shoot anyone, I don't fire the weapon, but if I draw my weapon, where the data is going to be required that they keep such data. So that is something that will be, I think, instructive for all of America going forward, and it was already in the works. Now, in terms of reform regarding other laws and police tactics and procedures, that is something that I believe you will see local jurisdictions all over the country begin to give direction to law enforcement agencies as they set public policy. Every good law enforcement agency should desire to be transparent, to include the public in the process of helping them set public policy regarding use of force or other things that they do on behalf of citizens in our society. So I don't think that at this point the solution is to throw the baby out with the bathwater. You know, we need law enforcement in our community, and so defunding police agencies isn't the answer. I believe that if you want them to improve in terms of the desired response, it requires hiring the right people in the first place, and a part of that is paying them adequately. Then secondly, making certain that they have the best training possible. And so defunding the law enforcement agencies at this time when training is important. Diversity and inclusion training, et cetera, all of that is important. May cost some money to do that. There are calls to require law enforcement agencies and officers to all wear body-worn cameras and have them operational at all times. Well, just the data collection associated with that alone is an enormous amount. And even if the public sector law enforcement agencies do not continue, and there's a desire to privatize it and somebody has to provide that service to protect the people. Whether that's if they work for public sector employees, the government, in other words, or they work for some private sector entity that's contracted with the government, the service needs are still going to remain there. So it's a complex answer to make sure that they have appropriate supervision, accountability measures in place in terms of this renewed call for citizen oversight, whether that's citizen review boards or the like. If you put any of those things into practice in any jurisdiction, it's going to be some money associated with having that type of oversight. So now is not the time to, I think, be so frustrated that we hurt ourselves in the process. So I think that the communications has to continue where communities all across America, up and down the spectrum, whether it's at the federal level, the state level, or the local level, has to continue for us to have the right solution at the right time that we're dealing with.
This is the last question, Mayor, from Brian Lynch with Orlando Business Journal. What would you tell businesses who are questioning whether they should fill out the small business grant application? And he understands that the county wants to help 6,500 businesses with those small business grants. But is there an expectation of how many applications the county expects to get?
We still have capacity there. We're going to help 6,500 businesses and those who meet the qualification standards. The only way, what I would say to a business, the one way you can guarantee you will not get $10,000 is don't apply. So if you meet the criteria that we have already communicated and posted on the website, if you believe you meet that, then go ahead and apply. We didn't start today with the same kind of rigorous restrictions in terms of the number that we would process. It's still open. You can go to that website. If you're a small business and you meet those posted criteria, you can go ahead and apply right now. Okay. All right. I believe that's the last question that I see at this point. Why don't we break and then we'll do a brief portion in Spanish if that works. Is that okay for those of you representing the Spanish-speaking media? Unless you feel like you have an answer, then we won't do that. You have other questions? Okay, so then we'll stop and I'm going to ask my colleagues, Commissioner Uribe, Commissioner Gomez-Cordero, and my assistant, Elia Torres, to come forward at this time. Okay, welcome to the June the 8th Orange County government briefing regarding the coronavirus issues as well as other significant issues that we're challenged with as a community.
Bienvenidos al resumen para el 8 de junio con relación al coronavirus y otros asuntos que están afectando a nuestra comunidad.
I want to talk a little bit about the weather phenomena that we're experiencing, and then I'll talk more about the current state of affairs with some of the demonstrations, and then we'll go to the pandemic-specific issues.
El alcalde en esta tarde hablará un poco sobre los fenómenos atmosféricos, el estado de las demostraciones que hemos recibido acá en el condado y luego entonces platicará sobre la pandemia como tal.
Over the weekend, we had a trifecta here within our community.
Mayor, what's that again?
A trifecta.
Trifecta.
I mean, three things impacted us this weekend.
A través del pasado fin de semana tuvimos una trifecta o tres elementos impactaron nuestra comunidad.
Okay, the three things that I'm talking about here. One with the weather phenomena. As we enter hurricane season, we had a tornado that touched down here within the metro area.
El fenómeno atmosférico de entrada en la temporada de huracanes, tuvimos un tornado que afectó nuestra área.
The Orange County property appraiser reports that 42 structures sustained damage on Saturday, causing nearly $1 million in destruction.
La Oficina del Tasador de Propiedades nos reportó que 42 estructuras sufrieron daños, causando aproximadamente $1 millón en daños.
And we continue to see demonstrations in our community surrounding the issues with the police use of force.
Hemos continuado recibiendo demostraciones de la comunidad con relación a los problemas de la policía y el uso de la fuerza.
Fortunately, the demonstrations of protests over the weekend and the last several days have been peaceful demonstrations.
Afortunadamente, las demostraciones que hemos tenido en el transcurso del fin de semana han sido pacíficas.
So we're fairly confident that we have a safe environment by which individuals are able to demonstrate. And so today, both Mayor Dyer and I announced the lifting of the curfews that have been in effect for the last week or so.
Estamos confiados de que existe un ambiente seguro para esas demostraciones y tanto el alcalde Demis como el alcalde de la ciudad de Orlando, Mayor Buddy Dyer, han tomado la decisión de levantar el toque de queda.
So there will not be a curfew in place beginning tonight and going forward.
No tendremos una orden de toque de queda a partir de esta noche ni hacia el futuro.
Each week, we share our goals for the week, and this week we have 4 primary goals. First is to stop the spread of the virus.
Cada semana el alcalde comparte sus objetivos para la semana en curso. Esta semana, entre sus objetivos está prevenir la propagación del coronavirus.
Number 2, to serve as many families and individuals as we can through the sharing of CARES Act funding.
La segunda, servir a la mayor cantidad de familias e individuos posible a través del proceso de desembolso de fondos CARES.
3, to serve as many businesses as we possibly can through the CARES Act application process.
La tercera, servir a la mayor cantidad de pequeños negocios posibles a través del desembolso de fondos federales CARES.
And 4, to continue COVID-19 testing.
La última, continuar con la realización de pruebas de COVID-19.
Okay, I'm not going to go over the numbers because I know that Dr. Pino did that already. But testing will continue here in Orange County through Thursday at Ventura Elementary School in East Orange.
No vamos a hablar de los números, puesto que el doctor Pino los discutió extensamente. La próxima semana estaremos realizando pruebas de COVID en la escuela primaria Ventura.
In addition, testing will continue in partnership with the Orlando Housing Authority on Tuesday and Thursday to our senior and vulnerable populations at 2 apartment complexes.
Además, el transcurso de esta semana, martes y jueves, en colaboración con la Autoridad de Vivienda de Orlando, realizaremos pruebas al sector vulnerable de la población para residentes de ciertos complejos de apartamentos.
The testing will be done at Meadow Lakes Apartments and Omega Apartments.
Las pruebas se llevarán a cabo en los complejos de apartamentos Meadow Lakes y Omega.
For information, you can go to our website to sign up or make an appointment at ocfl.net/coronavirus.
Para información u obtener una cita, visite ocfl.net/coronavirus.
We will be reopening our website for applications for families and individuals tomorrow.
Reabriremos el proceso de solicitud para individuos y familias a partir de mañana.
We will continue to also take applications from small businesses who will be required to qualify for the $10,000 grants.
Continuaremos aceptando solicitudes de pequeños negocios que soliciten la ayuda de los $10,000.
You can find information about both assistance programs through ocfl.net/orangecares.
Pueden obtener información sobre ambos programas en nuestra página web ocfl.net/orangecares.
And just as a reminder, we will be reopening many of the Orange County athletic fields beginning tomorrow.
Solo a modo de recordatorio, estaremos reabriendo los campos deportivos a través del condado a partir de mañana.
For more information on which parks will be open and the hours of operation, visit our website at ocfl.net/parks.
Para información sobre los parques que estarán reabriendo y los diferentes horarios, visite la página web ocfl.net/parks.
Okay, and I'm going to ask Commissioners Uribe and Gomez-Cordero to come to the mics and share with you anything that they want to brief you on at this point. Okay.
Gracias, alcalde. Gracias a todos por estar aquí, a Telemundo. Quiero decirles que no se me desesperen mañana. El alcalde, gracias, alcalde, a Randy, a todo el staff por abrir mañana las solicitudes. Yo sé que hay muchos desesperados, pero quiero decirles que estamos trabajando bien duro, ¿verdad, comisionada? Para que usted pueda, ¿verdad?, llenar su solicitud y pueda aplicar y pueda beneficiarse de estos servicios. Mañana a las 8 de la mañana él va a abrir y mañana hasta 20,000 aplicaciones o solicitudes se van a escoger para que usted pueda y los pequeños negocios también puedan aplicar. Saben también que se está haciendo las pruebas gratis, como dijo Ilia. Gracias, Ilia, por toda esa translation. Gracias. Que pueden hacerlo en Ventura Elementary, que está en el Distrito 3, pero cubre, ¿verdad?, todo el área aquí del este de Orlando para que usted se pueda también beneficiar. Y el curfew, él ya lo sacó también, pero no voy a seguir, voy a dejar que la comisionada también hable. Gracias.
Muchísimas gracias y buenas tardes. Algo muy importante, pasó mucho hoy en la comunidad cuando las aplicaciones se abrieron esta mañana y se cerraron, pero creo que la gente sepa que esté paciente con nosotros. Hemos trabajado mucho, como dijo la comisionada, en este logro para que mañana también esté abierto. Por favor, pase la palabra para que las familias apliquen. Y también muy importante, los negocios pequeños. Está la oportunidad de todavía aplicar. Por favor, tomen ese medio para aplicar. Es tan importante. Y todavía le decimos que, por favor, usen las máscaras, mantengan la distancia. Mientras estamos abriendo más ahora en este tiempo, no nos podemos olvidar de esos medios que pusimos. Estamos viendo los números todavía seguir subiendo y es tan importante que nuestras comunidades sepan esa información directamente. Muchísimas gracias, con mucha paciencia. Estamos aquí a su orden para ayudar y para asistir a las familias. Gracias.
Gracias. Okay, we'll open it up for questions at this time.
Gracias. Alibet Suárez para Más 100.7. Mi pregunta es, ¿cuál es el mensaje para aquellas personas que en este momento tienen ansiedad y están preocupados porque piensan que no podrán tener la oportunidad de recibir la ayuda económica? Es decir, porque hoy, justamente cuando se abrió el proceso, ya en 10 minutos estaba en su máxima capacidad. ¿Cuál es su mensaje para ellos?
Is that a question for Mayor Demis? Mayor Demis, the question is, what is your message to our community or the community that is stressed, distance. What would be your message to them now that we have reopened the program?
I certainly understand some of the frustration that residents may have. The good thing about it is we still have money, significant sums of money to be able to provide to our residents. So I would encourage them that when we reopen to apply and just be patient with us as we go through this process.
Los residentes, que aún tenemos dinero, que es la buena noticia, los fondos están disponibles y su exhortación es que una vez reabra el proceso mañana, que por favor apliquen.
Buenas tardes nuevamente, Félix Pirela de Telemundo. Una pregunta para el alcalde y las comisionadas también. ¿Cómo garantizan que mañana sí abra exactamente este sistema a las 8 de la mañana para que no pase esa frustración en cuanto a las personas que se conectaron exactamente a esa hora y ya estaba cerrado? ¿Y cuántas aplicaciones esperan recibir para el día de mañana? Y muchísimas gracias por la información en español para nuestras comunidades hispanas del Condado Orange.
How will you guarantee that the system will open at 8 a.m. and not prior? And how many applications do you expect to receive tomorrow?
We have no way of knowing how many applications we will receive tomorrow, but we have the capacity to really receive an unlimited number of applications. I'll stop there for now.
No tenemos un modo de predecir cuántas aplicaciones vamos a recibir mañana, pero queremos asegurar que tenemos la capacidad para recibir un número ilimitado de aplicaciones.
And the process is designed to continue processing the applications until we expend the $72.9 million that we have set aside for this.
El proceso está diseñado para continuar procesando aplicaciones hasta que agotemos los 72.9 millones que fueron asignados.
The goal is to begin accepting those applications around 8 a.m. tomorrow. Sometimes to gear up, there's some technical things that have to happen in order to make certain the system is ready. But the ISS manager is here, and he's assured me that we're ready to go tomorrow.
Nuestra meta es comenzar alrededor de las 8 a.m., pero ciertamente hay unos aspectos técnicos que se toman en consideración y nuestro jefe del Departamento de Informática se encuentra aquí presente, nos ha asegurado que están listos.
So I know our ISS manager is here. He's fluent in Spanish. So let me ask, come up to the mic, Rafael. I'm going to ask him to come up to the mic, and you can ask him the question about how can he assure that at 8 a.m. we're ready to go. He runs the whole system, one of the top CIOs in the country.
Es uno de los jefes de informática más reconocidos en el área, por favor.
Mucho gusto, mi nombre es Rafael Mena y mi responsabilidad es la tecnología de todo Orange County. La pregunta que hizo anteriormente con respecto a las 8 de la mañana. Mi equipo tiene semanas trabajando para este programa tan importante para Orange County, que es el ayudar a los residentes y a los negocios pequeños acá en Orange County. Y esta mañana mi equipo, para estar seguro que todo estaba perfectamente bien, lanzó para probar los últimos detallitos unos minutos antes y tenemos una capacidad para 2,000 aplicaciones hoy. Bueno, tomó 5 minutos para que esas 2,000 aplicaciones se fueran procesadas. El alcalde ahora nos ha dirigido que mañana abremos el website para recibir hasta 20,000 aplicaciones. Por lo tanto, el website va a estar bien ocupado mañana, pero tenemos la capacidad para procesar toda la información. No le oigo.
Que si va a salir antes.
No. Mi plan es mañana para abrirla a las 8 en punto.
So, you asked me how I was going to guarantee. There you go, right there. That's the answer, Mr. Mina.
El alcalde jocosamente indica que usted le preguntó cómo lo iba a garantizar. Ahí está la respuesta, esa es la garantía.
Okay. Since there are no other questions, let me just say thank you all for being here. Hopefully, this has been informative for you.
Agradecemos la asistencia de todos y esperamos que esta sesión haya sido informativa para todos.
Muchas gracias.